their families, leave their loved ones, and come here to take care of our city. Admiral, let me say how grateful all of us are, and that this is a ship that is full of angels in this city of angels. The Admiral has been in charge of all the logistics on the Navy side to make this happen, and let me turn the microphone over to him and say thank you on behalf of a grateful city. Admiral?
Thank you, Mayor Garcetti, and thank you, Governor Newsom, for having me here today. The men and women of the USNS Mercy in the United States Navy, we're honored to be here in Los Angeles, supporting FEMA, the state of California, and the city in this ongoing COVID-19 crisis. You know, the Mercy behind me is uniquely outfitted for humanitarian assistance and disaster relief. One of the Navy's core missions these ships perform around the world. Our embarked medical professionals are highly skilled and trained and ready to support COVID-19 response efforts. And as said before, by providing care to patients in need of treatment not related to COVID-19. In that regard, they will in effect serve as a relief valve, allowing local hospitals to increase their focus on treating COVID-19 patients. We're extremely proud to be part of this whole of government approach to response and to serve the great people of our nation, the state of California. And with that, I'll turn it over to the governor. Thank you.
Thank you, Admiral, and thank you to Captain Quinn as well for your extraordinary leadership. They'll be doing rehearsals, as they refer to them, this evening, and potentially taking patients as early as tomorrow. So when we say this is operationalized, we mean that quite literally, allowing us to decompress the west of the LA County system, which is beginning to see those increases that were projected in our modeling, and a disproportionate sum of hospitalizations that are occurring in this region in particular make the Mercy so profoundly important to meet the moment and provide capacity for our entire healthcare delivery system. With that, we're happy to take any questions from all the reporters that are here and those that we know that are online, appropriately socially distanced. So on the 16th of this month, the question is around evictions in the state of California, around renter protections. Many know that a couple of days ago we announced a deal with 4 of the 5 largest national banks in America around mortgage relief, forbearance of payments for at least 90 days. A few weeks prior, we had put out guidelines for cities large and small and creating a legal framework where they could put moratorium together related to evictions for rentals, for tenants. Los Angeles has been a leader in this space, San Francisco, San Jose, 30 jurisdictions had moved already or moved now more aggressively to establish the framework, but only 30. And as a consequence of that, today we just established a new overlay for the state of California that denies the capacity for enforcement, court proceedings for any evictions through May 31st. So for tenants, through May 31st, there will be no eviction proceedings. There'll be no enforcement as it relates to your inability to pay for COVID-19. It does not preempt any local ordinances that go deeper or farther, but it is an overlay for the entire state of California. So this is regarding the numbers today, 26% increase. And I should note, there are different sets of numbers that come out. Some people track numbers in real time and report them in real time. We've been very disciplined to put out numbers that meet an exact moment on a daily basis so we can confirm those numbers. 78 deaths, 26% increase from the previous day, 3,801 individuals that have tested positive for COVID-19, 88,400 tests, of which tens of thousands of tests are still waiting for results. And so I caution people as it relates to the numbers to consider the magnitude of the number of tests that have been conducted that haven't come back yet, so people have a better sense of what to anticipate. That goes to the question about, are we seeing the surge that we anticipated? Our modeling is moving as we expected, and we're seeing in Los Angeles, and Mayor could talk a little bit more about this. In fact, I'd like him to, because of the unique characteristics of this region and in this county. They're seeing surge numbers that put them on track within a week to be in line with where New York City currently is, if they see the kind of increases they experienced yesterday. But Mayor, maybe you can talk more specifically about that.
Sure, and I think while we've been here, the county may have put out new numbers. I know Dr. Galley is here from the county. Yesterday's increase, though, of over 50% would, of course, have a doubling rate of less than 2 days. By that measure, we would be where New York City is in number of cases per capita in Los Angeles County 6 days from now, or 5 days from now, 6 days from yesterday. We would be in a slower rate of increase the day before in 12 days where New York City was. So whether it's 1 week or 2 weeks, as I've been sharing, we will be where they are. We will have doctors making excruciating decisions. We will be trying to figure out what we do with that surge, how to get ventilators, where to find beds, which is why it's such a great day, at least today, to know that the USNS Mercy is here. But that's the rate of increase that we're seeing right now in Los Angeles County.
And it just reinforces the point. Every minute is a minute lost unless we take advantage of the minute. Every hour is an hour lost. Every day is a day lost. And that's why I'm so pleased and proud of what's happening all across the state of California. Thousands and thousands of beds being procured, people coming back, annuitants that are retired coming back into the workforce, fourth-year medical students now saying, you know what, can you help license me temporarily? And I'm going to contribute to meet this moment. The PPE that we're trying to procure from every conceivable source, from every conceivable part of the globe, 101 million N95 masks that we were able to write a check for already that are starting to come in, getting these beds set up, getting the rehearsals done so they're operationalized. We are not waiting for the crisis to hit and then react to it. We're doing everything humanly possible to prepare, but our eyes are wide open in terms of the multiples and our capacity as a system to deal with a surge of what we anticipate may require 50,000 beds over the course of the next 6 to 10 weeks. Look, the hospitals are bearing a disproportionate responsibility, and that is to prepare for this moment and then to meet the surge. And as a consequence, their traditional payments that they receive through elected surgeries are down significantly or no longer exist. So they're in deep financial distress, and that's why we've all been sober. And while we're very pleased with the $2+ trillion stimulus from the federal government, none of us are naive that we're going to need more support down the line. Not only the states and cities, we have $15.3 billion that will come from the $2.2 trillion stimulus into the state of California, $6.9 billion for local jurisdictions like this. But it won't be enough. Hospitals will need that support, and the medical system broadly defined as it relates to our Medicaid system, our Medi-Cal system in the state of California. People that need treatment will get that treatment, and we will do everything in our power to make sure we're signing up people. We've extended our open enrollment. We believe, regardless of your status, that you have the right and we have an obligation to treat you and to take care of you. We'll assess those costs in real time, but our focus right now is less on the economics in terms of those decision making, but on the health and safety of 40 million Californians. Yeah, the question of being able to recalibrate people's current status as it relates to being third or fourth year medical student. We've already in that process to expand their licensing capacity to meet this moment, looking at scope of practice broadly defined, which is a deeply controversial subject in any environment, including this environment. Those conversations are well underway. We've done surveys of hundreds of thousands of state employees. We have EMTs, we have paramedics, we have firefighters, first responders. We have people with expertise that we never even realized that are now offering up those expertise to recategorize their current job descriptions and make themselves available, not only from a medical surge perspective, but a specific example just to meet the needs of all the unemployment insurance claims in the state, which have averaged over the last week 108,000 a day, over 1 million people accessing or trying to access our unemployment system. We want to get those checks out as quickly as possible, and we're trying to meet that surge, the same sense of urgency, and that is reprioritizing, reconstituting our workforce, including all of those individuals that are currently preparing to enter into it formally that may just find themselves in the middle of this much sooner than they expected. Yeah.
I just want to add one thing to that very briefly. Since we asked for medical personnel 2 nights ago to sign online to a portal, doctors who are in offices that are closed, nurses that come back from retirement, et cetera, I'm proud to report we have over 2,000 people just here in Los Angeles alone that have offered their services, who are trained medical professionals. And I want to thank them. I know San Francisco has done something similar as well to enlist folks, and we've been working very closely with the governor's office on that. Thank you. Over 2,000.
I know you brought it up from Cal Matters. How exactly is the state staffing nearly acquired hospital beds on the ship, but also in the hospitals it's leasing and possible hotels, and on that note of hospital beds, how many of the 50,000 beds the state is searching for will be needed for ICU?
Yeah, so of the 50,000 bed surge, that's part of our planning. 30,000 of those beds will come from within the hospital system and their footprint. And what I mean by that is extending their staffing capacity, repurposing their operating rooms to ICU rooms, putting tents up in parking lots, and providing a surge capacity that is equivalent to 40% of their licensed beds. Outside of that system, 20,000 rooms are being procured through the state, including the Mercy, which is 100% staffed by contribution of the American taxpayer and the incredible men and women in uniform, the Navy primarily, some Marines that are helping with logistics, and some civilians that are part of this operation. They're fully stocked, fully staffed with every conceivable need you can ever imagine that resides within or around this floating hospital. As it relates to other hospitals, Seton, we were able to find staffing. St. Vincent, we're negotiating to create the framework to find staffing. All of these other individual skilled nursing facility units and all of these other motels, hotels have different staffing requirements. I'll be specific as it relates to the 2 that come up next week. These field medical stations, part of the 2,000 President Trump has sent to the state of California. The first 2 will be done in partnership with the state and county, and that's how we'll staff those first 2. We're working with other counties and other jurisdictions on the other 6 in terms of how we staff. So it's a one-off, site-by-site determination, but the Mercy, fully staffed, fully operational.
When will non-COVID patients be transferred to the hospital? What precautions are you taking to make sure that
So yeah, this is an as they refer to it, as the Admiral refers to it, and he can speak more clearly, this is a COVID-free bubble. When we say bubble, it's the entire area around this site. The men and women that are on board are not going to be recreating nearby. There's strict protocols and procedures. No one can just randomly come off this ship. Everybody's being tested, and we have very strict protocols working with the county, Dr. Galley at the county level, in terms of managing those protocols within the county system to make sure non-COVID positive patients are making their way into this ship. This is an iterative process. It's a dynamic process. We'll start with a lower number of beds. In the extreme case, they have the capacity to go higher, including with ICU capacity. We're not looking for ICU capacity to begin with on the Mercy, and we are currently inventorying the ICU capacity throughout the entire state of California. But in the extreme, we're modeling just shy of 20,000 ICU beds through our May 20th modeling.
Given that this is from Karen Luna from the LA Times, given that it's Friday, we saw crowds of farmer markets and beaches last weekend. Law enforcement, should we get issued citations or tickets to people disregard the state orders for persuaded for private?
I'm going to ask the mayor to speak to that because he's been leading with some novel strategies as it relates to not just citations of individuals, but encouraging businesses to do the right thing through regulation and licensing, which is exactly the kind of leadership we need. As it relates to state parks, let me just speak to this. We shut down an additional 59 locations, 98 total parking facilities now are shut down, primarily all along the coast, north and south. In order to reduce what we experienced last year in terms of the surge of individuals that were not practicing safe physical distancing last weekend. We'll see where things go this weekend and the extent we have to ratchet up the enforcement or do even more to shut down those facilities. We will do so in real time. Each city has different operations. Each city has different strategies to how they want to enforce and notify citizens, but LA has been leading on that, and I'll ask the mayor to talk more about that.
Thank you, Governor. First and foremost, with the beaches, I was glad to see the guidance come out from the county today in the order. It's something we will do on the one beach that we run in Venice Beach, and down here, actually two beaches, in Cabrillo Beach. We will make sure that that is the law and that is enforced. When I'm asked this a lot, I say, look, we've got an A in terms of compliance. If you look at the data, California, Los Angeles, in terms of the restriction of movement. 2, there's a lot of self-enforcement going on. My executive officer, an employee of mine, when she left her apartment today, had 2 people say, what are you doing? Why are you leaving? She said, I work for the mayor. They said, oh, great, good, okay, you go. So there's a lot of that happening at the neighborhood level. 3rd, we use, first and foremost, our city employees, including our officers, to try to get adherence in a voluntary way, and that's the best way to move forward. We had one restaurant that tried to stay open, giving food to folks the first day. We visited them with a police officer. That's over, and it hasn't reopened in terms of food service inside since. In those rare cases where we need enforcement, we're absolutely prepared, whether that's shutting somebody's power off at a business that shouldn't be open, or whether it's giving somebody a citation. In fact, we even found price gouging. Our LAPD officers found somebody selling hand sanitizer for $80. Let them know that was illegal, and let them know that there's a criminal penalty. That hand sanitizer is now being sold for $7, or was sold for $7. So where we see that, we are prepared, but 99.99% of this can be done without any criminal penalty. But we're prepared if anybody is an outlier, because one person can be a super spreader. One person can kill someone. One person can kill themselves.
And I know that there's a constant drumbeat of inquiry as it relates to the National Guard. We have 500 National Guard men and women throughout the state of California only doing humanitarian mission, supporting our food logistics, primarily at our food banks. We have significantly increased our surge capacity through our state park system for state park patrol, and they'll be out in force this weekend with flyers, not citations at first, but again, we will tier our enforcement as necessary. I'll ask the director.
Yeah, Mark Ghilarducci, I'm director of the Governor's Office of Emergency Services. The question had to do with how we are deploying our resources, specifically the CAL FIRE incident management teams. In reality, what we're doing is we're really been strategically planning for how best to utilize resources. And right now, at this time, We've been providing all the different kinds of commodities and assets to support the local government. There has not been a specific need for an incident management team, but we have those in the wings, and we're ready to actually engage them when appropriate. We also are actively, while this is going on, strategically planning for and preparing for what obviously happens in California, and that is a wildfire season. And so those teams are actively, as we are sitting here today, working on that integrated approach to be able to deal with COVID-19 as well as protect our public in the event of a wildfire. So they're engaged, but at a different level at this time, and we'll engage them more as we need them.
Take a few more, thanks.
Max Michelson from Fox 11 News asked, there's been a change in tone in the public relationship between you and the President Trump that may have contributed to Mercy coming to California and not another state. Do you see this crisis as a turning point in the complicated relationship between the President and California? Could this be beneficial to California residents on other issues as well?
This is time for partnership, not partisanship. As I said, open hand, not a clenched fist. He's our president, and every direct request that I've asked the President of the United States, he has been responsive and he has tried to accommodate. This is just one of many examples. Those 8 field stations, 2,000 units in the state of California, 2 that will be up and running next week. The Mercy are just examples specifically of that collaboration and that cooperative spirit. When it comes to emergencies, wildfires, disasters, we've always maintained those two-way conversation, that engagement, and we'll rise above the politics, and I'm grateful for that, and I'm candidly grateful for his leadership for the state of California and the issues and needs that we have requested and desires that have been met so far. And I'll keep monitoring that and keep prodding and keep encouraging for us to continue to do more and see more support in the future. Yeah, no, the total number of positives, 3801. I don't have a number of how many do not have residences that have come in. And clearly, as this data presents itself and we're able to break down those numbers, we'll have a better sense. But let me just say, on the issue of homelessness, we have already procured, as of this morning, 4,666 hotel units that we are distributing throughout the state of California for prioritization at the county level for homeless individuals. We have, just in Los Angeles, the leadership of Mayor Garcetti and the county, they have identified that they are prepared to take 637 trailers that we were able to procure because of the leadership of Bob Fenton and Mark Gilladucci, and they're prepping those sites and preparing the resources that will be needed on site to meet that demand. So all of that's dynamic, all of that's happening in real time, and as you know, we distributed $100 million in emergency aid because of the leadership of Tony Atkins and Anthony Rendon and their colleagues in the Senate and the Assembly, and we distributed those dollars in emergency grants for homeless individuals to prioritize getting people off the streets, particularly seniors and those in encampments and those that are vulnerable disproportionately to COVID-19. So we have a lot of work to do in that space. It continues to happen in real time. Certain parts of the state, we're seeing more happening than other parts, and I've got a full-time team doing nothing else but prioritizing the needs of our homeless citizens as well. So we'll make a determination. We're still making a determination exactly how much. We've got $1.7 billion of that stimulus going for higher education. There's new assessment coming for K through 14. As I said, it's $8.3 billion, $6.9 billion for local jurisdictions, $8.3 that come in directly in block grants to the state itself. We've got transit money, $3.75 billion. We've got homeless money, $320+ million that's set aside for California directly out of that stimulus for our homeless programs. So we're assessing all of that in real time. We put out a new guidelines for our state budget just 48 hours ago, and we are looking at every single expenditure in our state. And all I can say is we will be making adjustments in real time, not waiting for the obvious, which is recognizing that there's a significant economic impact not only to the state but individuals, and we have to recognize that we've got to be here for the long haul. And the answer to the second part of that question is no, it's not enough. We're going to need more going forward. I know which one it's for. It's for the mayor.
You sure? Okay.
Are there any concerns in terms of supplies and the drive-through testing now starting to pop up is taking up key supplies such as masks, gloves, gowns, hospitals and first responders as the surge comes?
No, is the short answer. The number of personnel on those sites is a small fraction of our medical personnel in hospitals, and we have made sure through the county. And if folks didn't catch that, 101 million masks this governor has helped to procure. There is enough. We're not worried about today. We're worried about surges in the future. We all know that. The governor said that we'll need more. I think you told us $1 billion is what you're looking at for gloves. We're looking at huge numbers down the pipeline, but absolutely not. Nor would we take those masks and PPE away from those who are doing testing. That is an absolutely critical role. That's stopping people before they get to the hospital potentially. That's keeping them, if they're okay, at home, knowing that they don't have COVID-19. But I'm proud that we've done about, I think as of today, 8,000 tests through those drive-through centers here in Los Angeles. That's about a tenth, I think, of the state's overall tests. And we're going to keep ramping that up and keep doing that. To the earlier question, we don't have one single confirmed person yet who is unhoused with COVID-19. I expect that there are people out there. But I want to pause on that for 2 seconds because a lot of people keep saying, oh, we don't want to have a shelter near us or we don't want to have those people near us. Let's be clear. It's people who are housed who are infected first who would be giving it to people who are on the streets, not vice versa. So we need to break those barriers down and think about each other as equals. All human lives matter equally. And I want to thank those city employees, those contractors from the nonprofits,